Today, we're diving into a condition that you can't see, but for those who have it, the pain is so extreme, it's been called one of the worst experiences known to medicine. We're talking about trigeminal neuralgia, and we're going to break down what the research tells us about this incredibly complex and often misunderstood disorder. Just to put the stakes into perspective right away, listen to this quote from the source material. "The pain is real and serious, sometimes leading to suicide attempts." I mean, wow. This makes it crystal clear. We're not talking about just a bad headache here. The pain can be so severe, it can have absolutely devastating consequences. And that's exactly why it's so important that we understand. All right, so let's get right into it. What is trigeminal neuralgia? Let's build a profile of this pain, figure out what defines it, and who it affects. So the clinical definition tells us it's a condition with severe pain in the head and neck. You might also hear it called trigeminal neuralgia or atypical facial pain. But here's the most important part. Doctors can only diagnose it after they've ruled out every other possible cause. I'm talking tumors, trauma, you name it. They have to check for everything else first. And only when all those other possibilities are off the table and that intense pain is still there, do they land on a diagnosis of trigeminal neuralgia. So how common is this? Well, about 4 in every 100,000 people in the US have it. Now, you might look at that number and think, okay, that's pretty rare. And yeah, it's not super common, but here's the really interesting thing. It's actually the most frequently diagnosed neuralgia. So when it comes to disorders involving nerve pain, this is the one that doctors see more than any other. So if you have to rule everything else out first, how on earth do you actually diagnose this thing? Well, it turns out there's a very specific set of clinical clues that doctors look for. Yeah, there are 6 main clues that really act like a diagnostic fingerprint. First, there's an abrupt onset and a trigger. And get this, the trigger can be something as simple as a light touch or even a breeze on the face. Unbelievable. Then there's the nerve distribution, where the pain follows a specific path. The description of the pain is another huge clue. Patients often describe it as lancinating, which is basically like a sudden, searing electric shock. And the attacks themselves are brutal, but they're super brief, usually lasting less than a minute. What's also really telling is how it responds to medication. It often gets better with a specific anticonvulsant, which kind of suggests the nerve is just firing out of control, almost like a seizure. You put all that together with the fact that people can have periods of remission where the pain goes away, well, the diagnosis starts to become a lot clearer. Okay, so we know how to identify it. But this leads us to the biggest mystery of all, the central enigma of this condition. What is actually causing all this pain? Right. So what causes this debilitating pain? This is the question that's at the absolute heart of the struggle for patients and doctors alike. What is the root cause? And the clinical answer? Well, it's a single, incredibly frustrating word. Idiopathic. And what does that mean? It's a medical term for we don't know. The cause is unknown. There's no clear, identifiable reason why it starts. Can you just imagine the frustration? To be diagnosed with something this severe, this agonizing, and then to be told that we just don't know why it's happening to you, it's a really tough thing to hear. So if you don't know the cause, what can you do? Well, the focus shifts completely to just trying to manage the pain. And as we're about to see, that fight for relief is a really, really difficult battle. And the source material doesn't pull any punches here. It says, quite variable treatment is used with little success. That's a brutally honest assessment. It tells you right away this isn't a condition with some simple cure. The road to finding relief is often long, it's complicated, and sadly, it doesn't always work. So the way doctors approach treatment is really like an escalating ladder of interventions. You start with the least invasive thing first, which is medication. Those anticonvulsants we mentioned to try and calm the nerve down. If that doesn't work, you move up a step to injections. We're talking about using things like alcohol or glycerin right over the nerve to basically try and deaden it. Still no relief? The next step might be local nerve blocks with anesthesia. And then, if all else fails, you're looking at the last resort, neurosurgery. This could mean trying to decompress the nerve, or in the most extreme cases, actually severing it to stop the pain signals for good. And all of this leaves us with a pretty challenging question to think about. When pain has no clear cause, how do we truly find a cure? I mean, the whole story of trigeminal neuralgia is this stark reminder of where the limits of our medical knowledge are right now. It really forces us to ask, when someone's agony has no identifiable origin, how do we get past just managing symptoms and actually find a real, lasting cure?